Hello everyone, Dr. Isabel Hui, physical therapist. Today I would like to talk to you about back pain. Actually, I want to talk to you about the real cause of your back pain. So, if you've been getting pain in one side of your spine, or sometimes on both sides, not on your spine, but on each side or one side of the spine, and you've been receiving therapy, chiropractor for a few weeks or months, and you haven't been feeling better with the therapy, then you need to stay for this video. Okay, so the reason why I'm making this video is because lately I've been seeing patients in my clinic and they've been complaining of pain on one side of their spine. And I'm going to show you what I mean. So this is the sacrum and this is the ilium. So when the sacrum, attaches to the ilium, they form a joint. And this is what we call it the SI joint, this joint here. There you go, this one here. And these patients that I've been talking to you about, they've been complaining of pain on this bump over here. And you could feel it in your body if you bend forward and you run your fingers down through your spine on each side of your spine, and you're gonna feel a bump on each side of your spine. The first bump that you feel, this is the PSIS, and this is the bump that I was talking to you about, this bump. And this is where my patients are complaining of their pain. Not on the spine, so this is again up. So the pain is here. It's not on their spine. It's not on the spine. Okay, so this is their spine. You can see the discs in this side. So usually when I evaluate my patients, I sit down with them and I ask them questions related to their pain. Like, when did the pain start? What happened? What caused the pain? What makes the pain better? What makes it worse? But the most important question that I ask my patient is the location. Kind of like, real estate. Location is the most important question, right? So in this case, these patients have been pointing to this location right here. Not on their spine. This is their spine, the lumbar spine. No, the pain is right here. And again, they've been receiving therapy and they haven't been feeling better, and they don't know why. What is happening? What's wrong with them, right? What is the real cause of their problem? So after they tell me where the pain is coming from, the location, then I ask them, does the pain goes down, your legs? If they say yes, then my next question would be, does it go below your knee? If my patient say yes, if the patient says yes, it goes all the way down to my feet, then more than likely their pain is coming from their spine. It can be a bulging disc, a herniated disc, that is pressing on the nerves, and that usually refers pain down their feet in most cases. However, if my patient says, no, my pain stops at my knees, sometimes it goes in front of my thighs, on the side, sometimes on my glutes, on one side, sometimes both sides, but it stops at the knee, and they've been receiving therapy for a long time and they haven't been getting better, then more than likely their pain is coming from their SI joint and the therapists have been treating the wrong structure. Probably they've been treating the lumbar spine, and that's the reason why they're not feeling better. So if you are seeing a physical therapist or a chiropractor, please ask them to assess your SI joint, especially if you haven't been feeling better in the last few weeks that you've been receiving therapy. Ask them to assess your SI joint, as therapists we're very highly qualified to distinguish between pain coming from their spine or their SI joint. And we can tell you in less than 3 minutes what is the root cause of your pain and give you the right protocol for the right structure so you could feel better, right? That is the whole goal. And if you're not seeing a therapist, I would really recommend you find someone close to where you live and get it treated, because unfortunately this pain doesn't get better, it just gets worse. And in my next video, I'm gonna show you 4 exercises that are gonna help to get rid of your SI joint pain completely. Usually you will see relief after 3 weeks of doing the exercises every day, 2 to 3 times a day. It's only, like I said, 4 exercises. And by 5 weeks, most of my patients, I would say 95% of my patients, don't have any pain at all. Now, you do your exercises at home, but sometimes some of my patients will need what I call a manual therapy. So this is what I mean. Sometimes the pelvis, the reason why you have the pain, in the SI is because sometimes one side of your pelvis is higher than the other. So let's pretend this side is higher, right? And what the therapist is gonna find that about it. It's gonna realize quickly, because usually the side that is higher, the leg on that side is shorter than the other side because the pelvis is higher. So during the evaluation, the physical therapist will realize what's going on with your pelvis. And usually what I do is I'll pull down this side, the leg on this side of my patient, right, on this side of the pelvis, to level both pelvis like this, like right now, because it was higher, remember? So if you pull the leg, it will go down, and we'll give you exercises to stabilize so it doesn't move anymore, it stays there, right? That is the whole purpose of that. Once in a while, one side, let's say this side, is out, the pelvis is a little bit out, and we call it an out flirt. So again, there are exercises to bring the pelvis into position. And that's the reason, because it's out, it's causing pain here, right? So we'll bring it in. And again, there are different exercises that will help with that to stabilize it. Now, in other cases, some of my patients present with what we call a sacral torsion. So what it is if the patient has a sacral torsion, that just means that the sacrum is tilted. It can be tilted this way, or it can be tilted this way. So let's say that the patient is tilted this way. So as therapists, what we're gonna do is we're gonna put pressure on this side of the sacrum and bring it in here. We do what we call it joint mobilization. We'll bring the sacrum here to the right location, so it's straight now. And you will feel, if this is the problem, your problem, then by doing this, you will feel immediate relief of your pain. And then we'll give you the exercise for your sacrum to keep it in this place, stabilized together with the pelvis. So like I said, there are different reasons why you have pain on one side of your spine, and that will be based on your assessment on the evaluation of, done by the therapist or chiropractor. So again, next week I'm going to give you 4 exercises that are going to get rid of all your pain if it's coming from your SI joint. And if you like this video, if you feel like it was very important, educational for you, please give it a thumbs up. Subscribe to my channel, and if you have any comments, please do down below. And until next week, take care.